Can anybody hear me? This is Janet Hartnett from the National Disability Institute.
Yes.
Oh, fabulous. I really apologize. It's unusual when Washington goes silent. And our entire office, the phones have been down, so we're not sure what's gone on. But for those of you that have stayed with us, I really appreciate it. I am not going to do the introduction I was going to do because I'm going to go. I just want to welcome everybody to this webinar, and we're just really honored to have Michael Morris, who is the director and founder of the National Disability Institute, and the pioneer and visionary of the work that we've been doing. Michael and I have been colleagues for 10 years, and Michael has been in this field for over 30 years. And without any more delay, I'd like to introduce Michael.
Thank you, Annette. I appreciate the opportunity to talk today on this Real Economic Impact Tour webinar. As Jeanette said, I have been focused on the challenges that individuals with disabilities and their families face for many, many years from up here in Washington, D.C. I've worked on Capitol Hill. I've led several major national disability organizations, and as a result, founded a National Disability Institute some 6 years ago, really to put an even larger spotlight on the challenges of poverty reduction and advancing a better economic future for people with disabilities. I think all of us know, and the wonderful work that you do in your communities across the country, that poverty is something that all too often people with disabilities are grappling with every day. Most recent statistics show that across all American families, frankly, the greatest number of individuals and families are living in poverty since some more than 50 years ago, when the Census Bureau began tracking poverty data. What we know for people with disabilities is that easily, in whatever city or state you're in, the rate of poverty can be anywhere from 2 times to as much as 4 times the rate of poverty for individuals without disabilities or families without a member with a disability. It goes without saying, and certainly to this audience, that no group in America is more in need and more deserving of economic recovery and economic and financial stability than people with disabilities and their families. For millions of working-age adults with disabilities, a dependence on public benefits for care, income, for food, for housing has become a trap that all too often requires people with disabilities on public benefits to stay poor in order to stay eligible for those fundamental needs being met with public assistance. In addition to income, another dimension of poverty is a lack of assets. And all of you are very familiar with the research about asset building for people with and without disabilities. It improves economic stability. It increases long-term planning. It has assets produce greater educational attainment and increase civic engagement. What we know, too, from the research is that savings and asset building will impact positively mental and physical health. It will impact positively an individual's self-concept. It will change status with other community stakeholders. And in so many ways, it will directly impact quality of life. For people with disabilities, you are part of a movement. You are one of literally now thousands of individuals and hundreds of organizations that are changing the level of focus, the issue level, and the commitment to a roadmap out of poverty at national, state, and local level. Where do we begin? And to provide a little bit of context for this phrase, economic empowerment. First of all, what is it? Economic empowerment is about a shift in the acceptance of a life of poverty due to completely being reliant on public assistance and public benefits to focus on equality of opportunity, full participation, independent living, and finding a pathway to advance economic self-sufficiency. We know that economic empowerment is important because, again, it will improve financial stability, it decreases stress and financial crisis in one's life. Economic empowerment will provide opportunities to learn, earn, save, and build. It will offer not just an on or off public benefits, but a roadmap that can look at, where necessary, holding on to reduced public assistance while one really pursues saving strategies and asset building. Most importantly, it's about putting back control in one's life, from work to savings to asset building. What we know and what we're learning together is that there are new tools and strategies and new partnerships. What we're seeing at a community level in cities across the country, in growing numbers of states at a state level, and here in Washington, D.C. at a federal level, is the power and potential of cross-agency collaboration to remove policy and program barriers to self-sufficiency. In the disability community, we've been part of education, outreach, communication, and marketing of ideas, tools, and strategies to increase understanding of ways to save and build assets and both produce more income and preserve more income. We're helping people with disabilities with new knowledge, choices, and supports, and we've been helping shift thinking and focus from employment as an end to employment as a means to move and find an individual roadmap to greater financial stability and mobility. What are some of these new tools and strategies? Well, some impact with work that moves from the federal level to the state level and then touches the individual and family. Tools as the Medicaid buy-in, which enables people to continue to access health care as they return to work or work for the first time. It's about increasing access and benefit from earned income tax credit and other favorable tax provisions. It's about access in a growing number of communities to AFI providers, Assets for Independence grantees, access to individual development accounts to achieve an asset goal through match savings. It's about understanding, being aware, and increasing the utilization of the use of Social Security work incentives. It's about greater access and participation in financial education and affordable financial services. And it's about, on an individual level, savings and asset goals beyond today and this week, but immediate and long-term goals in terms of where is that roadmap going to take us. It's the utilization of peer support strategies, and in some cases it's also considering the possibilities of self-employment as an alternative to competitive integrated employment for people with disabilities. There are new partnerships that each of you in so many of your cities and communities have been a part of, this bridge between the traditional asset building communities and the disability community and many disability organizations in both the private and public sector. It's about building this bridge. And it's the wonderful ways that building that bridge, as we begin to use and understand each other's language, begin to utilize tools and resources that are going to make a difference in the life of people with disabilities and their families. The partnerships continue to grow. Real Economic Impact Tour and other projects of the National Disability Institute touch literally hundreds of organizations across each state. But on a city level, it's certainly about the engagement of a mayor's office. Sometimes it's an office related to economic development or workforce development. Sometimes it's an office of consumer affairs. It's working with United Way. It's the wonderful, extraordinary partnership with the staff and field offices of IRS. It's working with the regional offices and field staff of FDIC. It's working with individual development account providers, earned income tax coalitions, bank and credit unions, micro enterprise lenders, ownership and credit counseling programs, a variety of disability-related agencies, state developmental disability councils, VR agencies at a state, regional, and local level, field offices of Social Security, work incentives, planning, and assistance grantees to help with benefits planning and advisement, different types of peer support groups, centers for independent living, offices of mental health and community action agencies, and the others. At national level, this work for the past 7+ years has begun to see real changes that will also affect you at a state and local level. Within the Office for Community Services, for the past 5 years, there's been a technical assistance project working with IDA providers, helping them understand how to outreach to people with disabilities, helping them improve accessible services for people with disabilities. At the Department of Labor for the past 2 years, we've seen the Disability Employment Initiative, sometimes known as DEI. It's now in 16 states, as far west as Alaska and Hawaii and California, and as far east as states like Maine and Delaware and Tennessee and others, and Arkansas. This is an opportunity to work across systems, particularly the workforce development system, with disability resource coordinators. In many states, we're called disability program navigators, building greater access to the public workforce development system, but also getting multiple systems to work more closely together and being together and building a bridge between the goals for better employment outcomes, advancing a better economic future, financial stability, and advancing economic self-sufficiency. The work of the Real Economic Impact Tour and access to beneficial tax credits and deductions with volunteer tax preparation assistance and VITA sites across the country. The work with FDIC in getting out there with train the trainer programs and self-paced computer-based program Money Smart of financial education. Work and continued focus, growing a focus of the Centers for Medicare and Medicaid Services, from Money Follows the Person and Medicaid waivers, to look at community participation as also very much including a goal of advancing economic self-sufficiency. And as I mentioned, the Money Follows the Person, helping people move from large institutional settings and nursing homes back into the community and helping them with stabilizing their finances and looking at ways that they can be more able to participate in community life. The policy agenda is interesting and continues to change. Many, I hope, are familiar with Achieving a Better Life Experience, the ABLE Act, the new bills that were introduced towards the end of 2011 are House Bill 3423 and Senate Bill 1872. These are bipartisan bills. They're exactly the same language in the House and Senate. And this is another way to look at ways that families with a member with a disability or an adult with a disability could set money aside that is not going to adversely impact their access to specific public benefits like Social Security, like Medicaid, like housing assistance or food assistance. This bill has over 100 co-sponsors in the House of Representatives and over, I think, close to, or maybe now, over 10 co-sponsors in the Senate. It's a way, to me, of thinking about leveling the playing field in terms of those extra costs that people with disabilities often experience every day, whether it's in getting up in the morning, or it's transportation, or it's access to technology, or it's home modifications. This money set aside in the use of what are called the 529 funds, which are now used for families to set aside money for a member of the family's future college education, would be used as well for setting money aside for the benefit of those extra costs, which may not be covered by different types of public programs and public benefits. So it's an extraordinary new piece of legislation. It's been tried for several years now, and perhaps in 2012 it will see more movement. The FI reauthorization is the Assets for Independence Act reauthorization, HR 1623. This is, again, the IDA Match Savings Program. It continues year after year as an appropriation. An amount of money, I think usually between $20 and $25 million. Different grant applications are submitted from community nonprofits, sometimes from credit unions, sometimes from faith-based groups, and even sometimes from state government. The AFI program matches the dollars that are committed in that grant with AFI dollars. So it similarly matches on an individual level with individuals setting asset goals. For each dollar that a person sets aside from earned income, it will be matched anywhere from $1 to, in some cases, as much as anywhere between $4 and $8. It's a program that mandates financial education, and it's a proven program that actually can help people with one of three asset goals related to continuing higher education, starting a business, or owning a home or purchasing a home. So it has struggled, but it also is the kind of public policy development that we should be supporting. The SSI Savers Act, H 2103, tries to raise for the first time the asset limit for people on SSI at an individual level from the $2,000 limit to a higher level at $10,000, I believe, although I have to check this version of the legislation, it might be $7,500. And again, it's to remove barriers to individuals on SSI wanting to earn more income and not losing eligibility for the Social Security benefit, which often then is tied to their access to a Medicaid benefit. Also support the VITA Matching Grant Program, which some of you have participated in. This would give it permanent authorization rather than the way it's being funded, like the AFI program, simply year by year through appropriations. And bill numbers are HR 2151 and Senate Bill 816. Those are several of the legislative pieces that we continue to push forward, and I urge you to look into for your support and for you to talk with and educate members of Congress, both the House and Senate. We also work on a variety of other issues that are important to us. The WIPA grantees, as I said earlier, work incentives, planning, and assistance grants are offered by the Social Security Administration, SSA, and it created a national network of benefits advisors and planners. This authorization has been continued for a number of years now on simply a one-year extension. It will expire unless Congress does something by June 30th of this year. And different legislative fixes and proposals that are being talked about. There is not a bill number yet, but also, given the short period of time that is ahead, I would say an equal amount of effort should go to simply getting the appropriations to continue this network, and another year for further discussions on the way these benefits planners and advisors go beyond looking just at the public benefits program like Social Security work incentives and other public benefits, but also look at the favorable tax provisions like earned income tax credit, look at the issues around financial education and issues around credit counseling and debt counseling. There's a lot of discussion on how to make these positions more have more impact, produce even more valued outcomes, but it's certainly an important issue to us. Funding of DEI, the Disability Employment Initiative that I mentioned, which is funded in 16 states right now. There's going to be a new round seeking applications from states probably a little bit later this year in June or July, and I would suspect they'll fund another 7 or 8 states to get us almost to half the states in the country being funded. But there is no authorization for DEI. It is simply funding that particularly is led by the Senate Appropriations Committee and is expected with a continued push to try to see eventually all 50 states have a DEI demonstration program. The key to it, to me, is it presents the opportunity for those states that are funded not just to connect the different systems, mental health, developmental disabilities, Medicaid, Social Security, with the workforce development system, but also to take this from just a focus on employment to advancing economic self-sufficiency. And this initiative does talk to states who have the option of one of the boxes they check as to what their DI grant would work on is not only to produce employment outcomes, but also to focus on systems capacity to help people with disabilities advance asset development. So that's a second area. A third, and one you may not be familiar with because it doesn't exist yet, and it's called the Promise Program. This is a program that has been in President Obama's budget proposal the last 2 years. It would finally provide appropriations this past year with a push, I would say again, from the Senate Appropriations Committee and probably leadership from Senator Harkin's staff from Iowa, who chairs a subcommittee for funding for labor, health and human services, and education. This program is going to focus on with a competitive grant process on youth in transition. How do we get people less content and less directed on continuing their public benefits, SI, and its corresponding coverage under Medicaid? How do we get people to really focus more on work, on savings, on asset building, hopefully? The requirements, the specifications for this solicitation have not come out yet. Discussions continue at the U.S. Department of Education with Social Security Administration. They particularly are going to target youth on SSI, as well as maybe youth who are on SSI and young adults on SSI and or SSDI. So it's a program to look for, and it's an important opportunity to link, again, the goal of work to advancing economic self-sufficiency. And the final one, which exists in over 40 states, also a program that states have to apply for, is Money Follows the Person. The funding comes from CMS, Centers for Medicare and Medicaid Services, and it's an important program in moving people out of nursing homes and out of institutions, public and private, into more community living with appropriate support services. If that group of people are working age adults, there's an obvious way to also think about linking community participation to advancing economic self-sufficiency. All these issues that I just mentioned, the legislation and these different program initiatives, you can follow by being a subscriber and signing up for the NDI-produced Washington Insider. It typically comes out every month or every other month. You can go to www.realeconomicimpact.org and go find the resources area, and you'll be taken to an archived area of formerly done past issues of the Washington Insider, and you can sign up for future issues. It's a great way to stay on top of this national agenda, these federal policy issues, and pass the information along to others you work with and others you support in the disability community. What focus for the future? We talk here often about where is this field going. The Real Economic Impact Tour has done an extraordinary effort at growing public attention, building the bridge between the disability and asset building community, building a bridge to the business community, and engaging financial institutions to say, hey, there are people with disabilities also trying to find their way out of poverty, looking for ways to stabilize their financial position, and looking to find a pathway to advance to a better economic future. I think the issues for us will be access to the tools that are already out there, tools like IDA's Match Savings Plan, tools like free tax preparation and VITA sites, that they are accessible for people across the spectrum of disabilities, their understanding of use of Social Security work incentives, and for us really is thinking about not each of these as a silo, separate tool, but thinking how they blend or braid together for the benefit of a particular individual with a disability and a particular family. That's where the future work has to be. We're more aware of these independent tools and strategies, but how do we bundle them? How do we braid them for the benefit of an individual and family? Information and education, we just simply can't do enough. Educating the asset building community on the needs of people with disabilities, and educating the disability community on these tools, on these resources, on these new types of collaborations. Incentives, here again, helping people not be afraid of using beneficial tax provisions, not being afraid of using work incentives, not being afraid of using some of these tools which have often waivers against counting in any asset or resource testing for public benefits. It's helping people be more aware, and as I say, bundling and braiding these incentives in a way that works for each individual at a point in time. The realignment, clearly, we need to elevate the asset and resource testing, both income and resource testing that exists for, as we said, SSI, that exists for Medicaid, that exists for under rental subsidies, that exists under SNAP, food subsidies, food assistance. And there's growing interest in this. And there are a number of states that have moved to raise those limits to further not pose a barrier to low-income families who really want to build a pathway to a better economic future. Relationship building, here again, is finding the better, new, improved ways for government programs to work with the private sector, not-for-profits, to work with banks and credit unions, work with employers, and recognize financial stability is an issue. for people with and without disabilities. Bankruptcy and home foreclosures are reasons people often face major absenteeism from work, and often is the beginning of a downward spiral out of work. Relationship building, communication and collaboration. We know that we have only begun to touch, probably even in the most positive estimates, less than 10% of the disability community about this agenda, about thinking beyond employment to advancing a better economic future. Well, we must continue to use new and exciting, improved ways, social media, to reach more people. We know that, again, partnerships with you at a city and state level, we've used in more efficient and effective ways dissemination networks across new and traditional media to get the message out. We need to do more to document the success stories that you and we have personally been a part of, so that people get the idea that, hey, this isn't impossible, this is very possible. People are becoming, in greater numbers, earners, they're becoming savers, they're becoming investors, they're becoming asset developers. We've got those stories out so people can believe for themselves that it's possible. Some of you have had the opportunity, if you've been to maybe one of our mayor's leadership academies, or you've personally been engaged by Cynthia Battles through her blog. I think she sums it all up when she said to us now 4 years ago, her words are I think as powerful and meaningful today as they were back in 2008. The American dream seems simple: to live on my own and be self-sufficient, to live with dignity and independence. I struggle with my finances right now, but I am an optimist. I believe that I can make progress with my job, move forward, and become a part of the mainstream economy and achieve my goals. Each of you has been working or knows of a Cynthia. Another name, it's John, it's Michael, it's Melinda, it's people in your community, and they are struggling to find their individual pathway. Our success will be defined by our ability to continue to forge the partnerships that are going to continue to open up new options and improved options for each person to find their pathway. That, to me, is the bottom line, and Cynthia Battles certainly expresses it well. We all want the American dream. We all want to be a little bit more self-sufficient than we are today. Some of us need a little bit more help and a little bit more support, and whether it's your VITA program, or it's a financial education program, or it's the bundling and braiding of multiple resources with Super Saturdays and financial fitness fairs, individual coaching, we're really creating a roadmap that is changing, and that roadmap is getting clearer every day. So I personally appreciate what you're doing. I appreciate the opportunity for those of us at National Disability Institute, Jeanette and Michael and Kate and Caroline and Kate and Lisa and Kia and so many others who are part of our team at National Disability Institute. We're continuing to look for ways to make that economic future more possible and that American dream more possible, helping us find that pathway. So stop there, and I'll open up to any questions. I do see one question which come in about a sense of how many youth are currently receiving SSI or SSDI. I don't have that number at my, right at fingertips, but I can tell you this, is that the roles of Social Security have been dramatically growing since the recession occurred in 2008. The fastest growing population are actually at the opposite end of the spectrum, are adults over 50. And the economists and researchers who have studied this phenomenon are documenting is that, in fact, employment insurance benefits are running out, and people are looking for some survival mechanism, some income, while they continue to search for a job. So many age 50 and over are applying to go on to SSDI and are coming on to SSDI. The total number today of people on SSI and or SSDI is over 11 million. And the number has grown rapidly just in the last 3 years. But we can find and post, I don't have it at my fingertips, the number of individuals who are youth, let's say under age 18, we can find that number. I've been told that the PowerPoint will be archived, and materials from this webinar and previous ones are available through the website, www.realeconomicimpact.org. Anybody else? Question? Comment? I don't hear anything. I see a question. Is NDI advocating for the authorization of the Work Incentives Planning and Assistance Programs that currently end, as I mentioned, June 30th? We will lose the valuable educated expertise, which is a disaster for SSA beneficiaries. Yes, and I commented on this, and it was one of the targeted areas in our public policy agenda. As I mentioned, but I'll repeat for those who may not have heard it, is it's important that we look at it both ways. Yes, it's important to get this reauthorized with people agreeing on the language for the reauthorization of the WIPA program, but time is very short. And in a parallel track, we will be working on getting another one-year extension through appropriations, which requires less activity and energy by Congress. And so we support both and agree this is an area that, again, is part of this network of collaborations and relationships that can help craft and develop and design an individual pathway to a better economic future. I'm seeing some comments about people who have tried working with vocational rehabilitation have dropped out. And what can we do to help re-engage them? I think this is the most important pieces of what I call the DEI initiative, Disability Employment Initiative, which is funding through the U.S. Department of Labor, Employment and Training Administration, and the Office of Disability Employment Policy. As mentioned, 16 states are currently funded. Another 7 or 8 will be funded when new applications are sought. Probably will come out in June or July, and decisions made in September, late September. Here, what they're doing is saying this is not the only way. The workforce system, in collaboration with their state DD system, mental health system, the use of the Ticket to Work program, using multiple systems in what are called integrated resource teams, or another acronym, ART. This may be another way. So if you write me, I'd be willing to talk with you further. Maybe you're in one of the 16 states that's currently funded, or if you're not, to be prepared to talk with your State Department of Labor now, even before the solicitation comes out, and try to see, hey, why don't we apply for one of these grants? The grants are anywhere from $500,000 to several $1 million, so a good opportunity. Question was asked about, I mentioned one of the fastest growing populations on Social Security benefits are those people over 50. Question is, which specific programs would you suggest we look into to help this segment? Well, here's a group, again, who may be assisted by some of the Medicaid waivers that states are now putting into place. Again, each state has such a different approach to the way they use Medicaid dollars, but there may be opportunities with your state's Medicaid waivers that are looking more and more at community participation, including helping people get back into the workforce, because income is going to change quality of life experience and degree of participation in community life. There are also mental health transformation grants. If the population are people that may be with mental health challenges, there's a large network of peer support recovery centers who are beginning to do more work in this arena, and that may be another way. I think financial education programs are important as well, because this is a population who's going to be struggling with limited income and limited resources. So those of you who are running financial education programs or tying those to your vital work with Super Saturdays and other special events, I think there's a way to attract this audience. Okay, they're telling me we're out of time. I could not leave us without thanking wonderful and generous sponsorship of Bank of America and Walmart, who has continued to support us in bringing the Real Economic Impact Tour to you and supporting our work here in Washington, D.C. I hope you'll sign up for the Washington Insider, look at issues, get involved. This is an election year. Talk to and educate your candidates, both incumbents as well as people running against incumbents. We're today in supporting an effort to build pathways to advance a better economic future for low-income working families, including people with and without disabilities. Get active in educating your candidates about the work you do and about the more work that needs to be done. Thank you so much. Look forward to hearing more about the wonderful work you're doing out there. We greatly appreciate it. Take care. Bye-bye.